Online, 800WVHU.com, and on your phone with a free iHeart app. 7:04, Monday, May 15th, 2023. Let's go to U.S. Congressman Brad Wenstrup, who represents Ohio's 2nd Congressional District. Good morning, sir.
Good morning. Good to be part of the tri-state conversation.
Hey, yeah, glad to have you. And lots to talk about, particularly, well, before we get into all the things to talk about, I hope you and your family had a great weekend, Mother's Day weekend.
We did. My wife really enjoyed the time when the family was all together the whole time, and got to celebrate my Mother's Day. She's 90 years old.
Oh, wow. That is awesome. That's awesome.
Yeah.
Good deal. And is she in good health?
She is. She's still living in the house I grew up in.
Wow. Fantastic. That is
we're lucky.
Yeah, that's pretty neat. That's great. Well, listen, let's talk about, first off, the border crisis. 83,000 migrants illegally entered the U.S. last week. We were already at an unsustainable pace, and now it seems to be getting worse with the end of Title 42.
Definitely. This is a huge problem across the board. You know, just you look at in 2021, over 100,000 Americans died due to drugs, and fentanyl is leading cause of death between Americans aged 18 to 45. This is a consequence of the cartels actually running our border. The cartels are making the money, bringing people across, and making money and killing Americans by allowing the drugs to come through. So it's a lose-lose for America, but this administration seems bent on continuing to do this. Look, there's no other country in the world that is doing anything like this. Even in Jordan, you know, where the Syrian refugees legitimately are coming into Jordan and are being held in camps until they're fully processed and everyone knows who they are and where they are. But since President Biden took office, there's been over 5 million people that have entered the U.S. illegally. I've been to the border, as you probably know, Tom. I've been there. I support the Customs and Border Patrol. People that are down there trying to do their job, there's just not enough of them. And, you know, between the loss of life that we're all seeing in our communities from fentanyl and then the invasion of migrants coming into our communities where we're not able to handle them, and then the hardworking people of America are supposed to be the ones that take care of them, it's a problem. So, I voted for the Secure the Border Act, which we passed out of the House, closed border loopholes, provided security for the country, addresses the fentanyl issue, and it reestablishes the operational control and fighting back against the cartels. It also ends incentives for illegal immigrants to come across with catch and release. And also we included that finishes building sections of the border wall that President Biden discontinued that were in place under the Trump administration. So we're trying to crush the cartels, their revenue, make America a safe and lawful place. We're ignoring our laws, and that's a big part of the problem.
Yeah. And obviously that's not going anywhere, I'm guessing, then? That's not, that bill in the Senate is not going anywhere?
I wouldn't imagine it's going to take some changes in the Senate. You know, we have the majority in the House of Representatives, and so we're passing reasonable bills with the idea that these are bills. This is a bill, for example, that would allow more freedom and security for the American people. And the next generation of Americans would likely say thank you for doing it. But it probably won't go anywhere in the Senate, unfortunately. And I feel pretty certain as long as Mr. Biden is in the White House that he wouldn't sign it into law anyway. But we're letting the American people know at least what the House of Representatives is for. And who knows, it may be something we can bargain at some point.
Did that Border Security Act that you mentioned, did that include E-Verify, or is that separate?
There are some components about E-Verify, and that's going to be that's a whole nother set of circumstances that we need to address, and knowing who people are and what their background is going to be a part of it. And I don't know that we're gathering all that information, Tom.
When you look at that, and I've kind of gone around on that issue, and maybe I don't understand it, but I was seeing where Congressman Massey was putting out some things that he was concerned that a national system for E-Verify could be used against American citizens, and he basically saying that it could be something like a V-Verify. He was saying like a vaccination verify. Is there any truth to that?
Well, Thomas always thinks things through. I have to give him a lot of credit, and he's always looking for ways that some people may use things in the wrong way. I can understand his concern with that. That if you're gathering all information about people, is that going to be something that has to be included? And we can certainly have that conversation about vaccinations and about immunity.
That'd be a good transition then with the COVID origin subcommittee that you chair. What's the latest on that?
Well, our most recent hearing that we had was on immunity itself. And everyone knows about the notion of getting immunity from a vaccine, which, of course, has been insisted upon by the administration through mandates, et cetera. But natural immunity, as it's called, is actually infection-acquired immunity. In other words, you've had COVID, and so you developed immunity. And what does that look like? The Biden administration or CDC officials, they pushed a false narrative regarding the vaccine, which resulted in a real loss of public trust, I think, towards our authorities. President Biden claimed that if you received the vaccine, you would not get sick, would not end in the ICU or die. But we know from the very trials that the vaccine was very helpful to people, probably saved hundreds of thousands of lives. But it's more of a therapeutic than it is the vaccines that we're so used to. And so I do recommend that you get your normal childhood vaccines, not necessarily this one. Actually, I don't know that any child needs it unless they have an immune problem. But then you also had CDC director telling Americans that vaccinated individuals could not spread the virus. And these statements turned out to be false. Nothing is 100%. And so what we were talking about was how much positive effect natural immunity actually has for people, and why were we not entertaining that and looking at that in the science world, at least that run by our government. Other governments took it into consideration and did pretty well. So the decision to vaccinate or boost as we go forward, it should be between the patient and the doctor, not from a mandate from the federal government or a state government. We've got to reestablish the doctor-patient relationship and make those decisions on real data. And these are the types of things that were coming out of our hearing. So instead of mandates and no physician, we need to have personal medicine where all things are considered, such as were you vaccinated? Do you need a booster? Have you had COVID? Do you even need a vaccination at all? Well, those things are still kind of hanging out there because we didn't do a good job in studying the data. But natural immunity was dismissed in the United States when Europe and other nations recognized the protections it offered, put them into place. We ignored centuries of science, which is that when you get something like a virus like COVID or other viruses, you build some of your own immunity. This is not new. What's interesting, Tom, Sweden and Michigan are relatively good comparisons. Similar populations of people. And, Michigan had stringent lockdowns and mandates. Sweden did not. They're very similar populations, similar numbers, and Sweden had half the deaths of Michigan. And I just think that we ignored numerous studies and some research that supported infection-acquired immunity and the vaccine mandates and disregard for that the natural immunity. It really cost a lot of Americans their jobs, kept kids out of school. It was very disruptive to the United States of America. And, I think that we have to look at the data, when decisions are being made, and decisions shouldn't be made politically or for personal gain, perhaps. And those are the things we're looking at in our committee, and we're making a lot of headway, and we're getting a lot of honesty that's brought forward. And so a lot of questions as to the motives as to why so many of the decisions were made from our public health officials.
You know, one of the things that, and this is very disturbing, the number of people who are denied life-saving organ transplants because of their vaccination status. I've read stories about that from Cleveland Clinic to Alabama. I mean, just places all over the country where somebody goes through all the hurdles, all the hoops, and they're ready to, there's a match, they're ready to receive a life-saving organ transplant, and then they get to the vaccination status, and all of a sudden they say, oh, no, you're not eligible because you're not vaccinated. I mean, there was one where a child was not even allowed to get the operation because his father wasn't vaccinated. I mean, it's just mind-boggling. How can our health systems be still doing this type of thing?
Well, there was very much a push by those in public health to force vaccines on top of everyone. And look, actually, it's interesting. Stanford actually had a test that was available early, and it seems to me the CDC just ignored it, but it could determine if an asymptomatic person who tested positive for COVID was actually infectious to others. This is important. This could have been very, very helpful, and it seems that the CDC, the NIH, the National Institutes that Fauci directed, and the White House just chose to ignore it. And, you know, I'll tell you what, that particular test, it would have made it very clear that it was safe to go back to school for the kids. Teachers' unions, they wanted to be vaccinated first, and as a nation, we let them be. Now, certainly there's going to be some teachers that are at high risk for loss of life, depending on their comorbidities and immune status otherwise. And that should be taken into consideration, but not blanket across the board. And it seems that when they got vaccinated, then they wanted the kids to be vaccinated. And this simple test would have shown that kids probably don't need it. Certainly the data on healthy kids was that it wasn't a problem. COVID was not a problem for them. But instead, we had all these school closures. And even the mayor of Chicago, Lori Lightfoot, was very critical of the teachers union in Chicago for keeping the schools closed and the effects it has had on our children going forward, on their physical well-being, their mental well-being, and certainly their academic well-being. And certainly they're on the same page politically, I would think, but even Lori Lightfoot in Chicago was condemning the teachers union for their closing of schools. And at the same time, other schools were open, private schools were open. My kids were in school. But that makes it fortunate for those that can send their kids somewhere else. But without school choice, so many, especially low-income and minority children, they're the ones that are going to suffer the most from these decisions that were being made.
Congressman Wenstrup, when you talked to the head of the teachers union there, I mean, the one thing that came out that stood out to, I think, a lot of Americans was the influence that they had in writing our health policies.
Absolutely. You know, there's no doubt about it. We found out that the teachers union were not only in touch with the head of the CDC, where President Weingarten had Dr. Walensky's personal cell phone number, which I don't have, and others, members of Congress certainly do not have, but she had that. And also they were in touch with the Biden administration transition team early on. And I think it's fine for the CDC to reach out to various organizations to get their opinions, but the teachers union is a political organization. It is not a medical organization. They're different, I would say, from the School Nurse Association, which all of these are political, but at least the school nurses have a medical background as part of their conversation. And in testimony, School Nurse Association president said the schools should have been open. So we're seeing just a real disregard for the science here, but really taking guidance from a political organization. And, you know, at the end of the day, the CDC took two of the guiding recommendations from the teachers union, and some of those included mitigations that make it impossible for the schools to open, or certainly much more difficult. If you are going to change your guidance from 3 feet of social distancing to 6 feet, that makes it pretty tough to put those kids in the classroom. So it seems the CDC's reopening guidance was used to keep schools closed. And that's what we got stuck with for so many of our American kids and their families.
Now, will your committee be looking into, and maybe you already have, I hadn't seen it, the hospital protocol that came about during COVID, which left loved ones outside the hospital when their family members were in the hospital dying alone? And not only that, but there was no patient advocate there for them. And people went in with hopes of, hey, just need to get some oxygen, get some meds, and get back out. But instead, they go in and they just keep getting worse. And the next thing you know, they've gone on remdesivir, they've gone on the ventilator, and then they're gone.
Yeah, early on, obviously, that was a big part of it. And I can understand precautions. We've always had precautions. I can tell you as a doctor, and I treated a lot of infections that needed to be hospitalized and taken to the operating room, et cetera. And you had various precautions that were taken when you would enter the room of someone with a certain level of infection. And that would go for as far as the nurses and the doctors and everyone else. And so we do need to look into that, because from the standpoint of trying to reduce anxiety for patients, from the standpoint of moral support and the effect that it has on patient care, it's huge. And you see so much today that you really need a family member or a dear friend with you a lot of times to be there for you, not only for your own well-being, but to make sure that the decisions that are being made on someone's health come with a collaboration with a loved one. And that was taken away, and they had effects not only of the person in the hospital, but those that couldn't see their loved one. And it was certainly debilitating. We need to address that, and so many issues like that that just have come into play, that we have to question what we were doing and was it the right thing to do. Now, some of it, I would admit, is retrospective. And at the beginning, no one really knew what was going on. But when we started to gather data, we should have been smarter about how we handled things.
Congressman, I believe the president and the speaker are going to meet again regarding the debt limit. Will Republicans hold the line on this and make sure that there's spending cuts?
Well, I think that that's the important thing that we're making. The point is, like, there is no reason we can't do both of these things. I can remember being in an interview months ago, and President's spokesperson had said, the president just wants a clean debt ceiling. Forget it. That's it. But the president's always willing to negotiate and discuss ways of reducing spending. Well, why can't you walk and chew gum at the same time? And you had a clip on earlier from my friend Byron Donalds, who just said it very simply. It is upon us to do both things. We want to pay our bills, and at the same time make corrections so that we start going in a better direction for the future of America, that we don't continue to drive up our debt, because the nation can go bankrupt, and that is certainly not what we want. So we have put forward a series of things saying these are good places that we think we can cut. Let's have that conversation. And it does seem like the president is willing to talk, but they were supposed to talk Friday, and now it's again next week. Hopefully, Kevin McCarthy can work something out with the president, and hopefully that's just the beginning of a positive trend forward on how we're spending, because we have way overspent. The Democrats have themselves, certainly some things during COVID, we all drove up the debt, bipartisan, in an emergency situation, and I wish we had a rainy day fund instead, but at the same time, what they have spent since that time, and money's just still sitting out there, we've got to start looking at trying to bring some of that back, rein that in on behalf of the American people and the future of America. Hopefully those conversations can be fruitful in some way.
Republican U.S. Congressman Brad Wenstrup, representing Ohio District 2. Sir, always great to talk to you. Thank you for coming on.
Yeah, thank you, Tom. You have a great day.
All right, you too.